I have uploaded a PowerPoint, and actually it is on your e-learning platform. So you do not have an excuse of having low quality notes from my end, because you can actually download the same from your end, from the e-platform. So if we go up here, we have this topic 3 resources, but the presentation is named topic 3 presentation, the one that I'm going to be using today for our today's lecture. So I am sure that from your end, if you download this topic 3 presentation, this topic 3 presentation, you will be able to follow the presentation that I'm about to start sharing now without any complaints of quality notes from your end, regardless of whichever mode of phone you are using or resolution of your. So do that in a few minutes, and then I'm going to start off. So that is the topic 3 presentation. That is the presentation that we are going to be using today. You cannot pause on whether you have been able to upload, to download, sorry. This is what you're downloading. Topic 3 presentation. Me from the platform. And you can respond whether you've been able to download what I have shown you. Yeah, that is what you are downloading. Topic 3 presentation. Topic 3 presentation. That is what you're downloading. So I trust you have been able to do that. If you have any question, you can type on the, and I'll be able to respond. And then we go straight to that presentation that I have requested you to actually download, so that there is no excuse on your end that you cannot see this, you cannot see the other. You have everything with you, so that we'll be together throughout. So I have introduced myself, and I have indicated that our today's topic is topic 3, mode of transmission of HIV/AIDS. If I can take you through a recap very briefly, in the previous lectures, you were introduced by my colleagues what HIV is, what AIDS is. You looked at the prevalence and distribution And you also looked at the theories of origin. So HIV, which is human immunodeficiency virus, this is a pathogen. A pathogen is a disease-causing organism in human, in animals, or in plants. And our concern today is HIV and AIDS. And AIDS is acquired immunodeficiency syndrome. Now, the key thing I want you to note here about human immunodeficiency virus, and this you have been told by other lecturers who have taught before me, is that this immunodeficiency, this is where the virus is targeting your immune system. And usually, HIV and AIDS is not the one that will mainly kill you. It is the other disease-causing organisms, because the body immune system have been weakened, and the body cannot defend itself against these infections. Now, it is not necessarily that you will end up developing AIDS or acquired immunodeficiency syndrome. That will depend mainly on your immune system and the intervention measures. These intervention measures include the treatment, and this treatment is just to bring the amount of virus in your system down, what we call the viral load. So it does not eliminate the virus from your system. It is only going to bring the viral load down, giving your immune system an opportunity to rebound and continue functioning relatively well. This is to say that if, and in most of the cases, if you are infected with HIV, you find that one of the policies that the government have tried to enforce over the years is not only provision of the antiretroviral drugs, but also testing. So why is testing so important? Testing is so important because the earlier the diagnosis is made and you start using the drugs, the better chances you have of redeeming your immune system before it is destroyed. So that is very important. And the possibility of you dying from HIV infection that is not being managed by any drug or any intervention is just as the same as having cancer. Now, this unit is supposed to equip you with knowledge and particularly skills that are going to help you if you are not positive to remain probably negative for the longest time that you can. And if you are positive, not to spread the infection to other people. And if you are at risk, probably we are going to tell you how you can prevent yourself from acquiring this infection by the end of the entire unit. So you are going to find that in subsequent lectures, we'll have sections talking about factors that are going to increase the possibility of you acquiring the virus. And when I talk of you, I'm talking of you and the community at large. So don't just look at yourself. Look at the society, look at the community, look at your friends, look at your siblings, look at your other people whom you care about. Because this information should help you first, but it should also help others in addressing this pandemic. Of course, this is a pandemic that have been there for the longest time. Now we have COVID, and we also have relation between COVID and HIV, which we are still trying to understand. We cannot purport to have already understood the implications of a COVID infection and HIV as an underlying infection, or whatever we call a comorbidity, such that you now have two kinds of infections, HIV virus and COVID, and we're still trying to understand what is happening when we have individuals suffering from COVID whom are already infected with HIV virus. Now, for the prevalence and distribution, this you tackled last week, and you are told that especially in Kenya, we have high prevalence. But what I want to note is that this prevalence is not the same in all the counties in Kenya, and is also not the same in various age groups. So you find people posting, what do you think, and how really we can prevent, and why this information is so important. I'll come back to that and sample what people have done, and considering that this is a huge class, you find that only about 10 people have logged into those discussion forums. Again, that is not one of the points, and I want to encourage all of us to engage in those activities. Theories of origin, you remember them. I'm not going to dwell on that. But now I'm going to give you a brief introduction on the transmission. So transmission spread, and spread from one person to another, spread in a different geographical region, and spread in the entire world, what we are calling prevalence. But in this case now, we want to look at the specific ways in which this spread occurs. Now, we have already said that this is a disease-causing microorganism, and it mainly gains access to your body through the mucous membrane or a broken skin from an infected person body fluids. Now, I want to pause there and ask a question. Why do we have even today, high stigma if a person is infected with HIV and AIDS. I'm going to summarize it in this way to connect it with the modes of transmission, because once we understand how the splend and ways in which the virus is transmitted, then we can be able to live with the infected people without stigmatizing. So the fluids that we are talking about is the blood, semen, preseminal fluid and vaginal fluids, rectal fluids, and breast milk. So the way I want to summarize stigma is this way. I knew of our family friend who actually was infected with HIV and AIDS. The way the news were broken to her, it was very unethical. She had people talking somewhere, a group of people, and pointing at her that, you know, this one is already HIV positive. Number one, how do you know a person is HIV positive? Kindly type that and tell me. So keep on typing your questions, please. Moremi, you're saying your connection have been lost again. So keep on typing your questions, even if I'm not able. We'll definitely continue responding to them after this lecture. Thank you. Jerry, Kamau Esther Jerry, you can kindly lower your hand because we have an issue we are resolving. I'll inform you immediately we have been able to do that. You can try to type your question, please, on the chart as that problem is being resolved, and then we can be able to get back to you. Thank you. Sorry for that inconvenience. I think now I'm sorry for that inconvenience. We had a technical problem, and we have been able to solve that. So what I was saying is that with these three states, we have the disease state. This is where you exhibiting signs and symptoms. And the good news is that when you have destroyed the virus in your system, then you are not able to transmit to another person. Unfortunately, if you are in a carrier state where you have the infection but you are not showing clinical signs and symptoms, then you are able to transmit the infection. But unfortunately, unless you are diagnosed, then you are not able to seek for treatment. But during the disease state, we already have signs and symptoms, and you find that in this case, you'll be able to go to hospital and seek medical care. I have seen that people have typed on YouTube that some of the signs is brown hair, loss of 10 kilos, which we call the mass wasting. And I have seen that those are the two main signs and symptoms that have been posted there. I have not seen any question, although I'm seeing hands raised here. I have not seen a question there. Now, this one we have already explained what happens when you're in a carrier state, you are not showing signs and symptoms, and your immune system is able to balance the infection. So under the disease state, this is where your immune system is weak, and this is where you're showing clinical signs and symptoms, and we can be able to tell that you are unwell. For those people who are asking for this presentation, it is already on your e-platform. You can download it. Then we have the stages, and these stages are important because during these stages, you can also transmit the infection. If you want to learn more about the signs and symptoms for each stage, again, there is an e-resource for that in the e-platform. So you find that for when you start developing the disease, or when you start showing symptoms and signs, it is at stage 2 all the way to stage 4. So stage 1 is the one that we are describing as the carrier state, where you are not showing any symptoms, and we describe that as asymptomatic. Now, this is the medication that you can be given to prevent the spread, and under which circumstances are these medications recommended. Now, we have number 1, we have the pre-exposure prophylaxis. So prophylaxis is to prevent. So when we talk of you preventing before you are exposed, that is what we are calling pre-exposure prophylaxis. This is if you are at a risk of acquiring this infection due to the fact that probably where you work, you are exposed, you are working with sharp objects, you are working with the people who are already infected, you are working with the, or rather you're working probably in a laboratory where you're handling this, because we have that kind of a laboratory, although the safety measures are very high. But if you feel that you are exposed, and in another instance is where, for example, your partner may be infected, but you are not infected. So that is when it is recommended to use pre-exposure prophylaxis. You are not infected yet, but we want to protect you from acquiring the infection because you are at a higher risk of actually acquiring the infection. So that is the one we are describing as pre-exposure prophylaxis. This is very important because you find that post-exposure prophylaxis is not, or what we call PEP, is not something that you can use for a long time. It is something that is used, and it is not 100% even, but it is better than nothing, and it must be taken within 72 hours of the exposure. So what is this exposure that we are talking about? For example, if your partner is infected and you are using another method, for example, the condom, and the condom, for whatever reason, was not able to be sustained throughout and it broke, then you become exposed. So under that circumstance, you can actually be put under PEP, which is usually taken for about 28 days. And this is highly discouraged to be used as a regular way of preventing you from acquiring the virus or from you getting infected with the virus. In cases of rape, in cases of sorry, in cases of it is important for you to take this kind of a precaution. Now, the other medication is anti-retroviral drug, the ART, and this one lowers the amount of virus in your system, and you find that that is important because if we cannot detect the virus in your blood, then you cannot transmit the virus to any other person. So that is why we are saying that the ART are so important in prevention of the transmission. So if the viral load is very low, it cannot be detected in your blood, then you cannot transmit the same. Now, the actual modes of transmission, we have them as follows. They are about 11, and we are going to look at each one of them and in a summarized version, because again, this is something that we are aware of over time. Is something that is not really so new to us. So the first mode of transmission is the sexual contact, whether oral, vaginal, or anal sex. So through the sexual contact, you can become infected. Remember, we said that when you come into contact with the body fluids, which are already having the virus, then that is when you acquire the virus. And sexual contact is one of the ways of coming into contact with infected vaginal fluids and seminal fluids and rectal fluids, which can actually transmit the virus from one person to the other. Then the other one is mother-to-child transmission, and this is during labor and delivery and during breastfeeding. And there's a group that was asking me why do we usually have limited time for the HIV positive mothers? Because the recommended time is 6 months, but for a mother who is HIV positive, their time may be reduced depending on what they agree with their health provider. And in some cases, they might be advised not to breastfeed at all, depending on their viral load, because through the breast milk, the transmission can occur. Now, over the years, this mode of transmission have been reduced significantly because of the ARV. Because once the mother have known her status early enough, then they are given the ARVs that keep on suppressing the amount of virus circulating in their system, thus lowering the risk to the unborn baby. So that is so important to note that these over the years have been addressed by the ARV. Now, transfusion of HIV contaminated blood is another way in which a person can be infected with HIV virus, and this is if the donor is already infected. Now, what have happened is that there is safety precaution measures that are usually put in place before a blood transfusion takes place to ensure that the blood is safe and do not have the virus. And this have gone a long way to ensure that that mode of transmission have also been lowered. So the main mode of transmission remains sexual contact. And this is so serious because for the past 5 years, the data we have is that we have one of the lists for the increasing transmission of HIV and AIDS is unsafe sexual practices across the divide. And you find that these have increased with over 7,000 times among the young people aged between 15 and 24 years, which is very unfortunate. You also find that, again, if you go to the other older age group, between 50 years and above, you also find that the same thing is happening. We also have an increase in the unsafe sexual practices in that age group. That's not to mean that between 25 and 49 years, we do not have that happening. It's only that it has been constant. But in these two age groups, this is where we have had a very high increase. And also, this have contributed to the increase in the number of people who are becoming infected daily. Now, before the ARV, it was possible to tell person A or person B is suffering from HIV and AIDS. Today, it is impossible unless somebody confides in you or somebody tells you, or by default, you know that that person is suffering from that kind of an infection, then you cannot be able to tell because they are able to live a normal life. And I think this is a stage where people now have maybe thought that it does not exist anymore or it is not a problem anymore. So I think that is something that we'll keep on talking about and we'll keep on creating awareness on that. Even if a person looks healthy, they may be carriers. They may be carriers, so do not assume that a person is not HIV positive because you cannot observe any signs, or the person is not complaining of any symptoms. Now, the other part is that we have the traditional practices involving scarification and cutting beauty marks. Now, this scarification is scar. It is derived from the word scar. Now, scar is where your skin is broken and then it heals and there is a mark that is left behind. Now, in this case, it is deliberate. It is deliberate scarring of the body for various purposes. This could be for initiating you to another stage, for example, to you coming from childhood to young adulthood. So there are many ways of initiation, but in some communities, we have scarification as one of the initiation methods that is used. You also find that there is those people who will cut their body in a particular version as a way of beautifying themselves. Now, this is likely to transmit HIV and AIDS if the instruments being used are shared among infected persons and uninfected persons. So those practices are there, and we know that in this class, we come from all corners of our country, and if we had a mic, we could have sampled in which part of our country this is happening. So we are not condemning it. What we are saying is that this should be done in a safe way, and if it is possible, we can also do away with it. This is now number 6. The other one was number 5, but there is no continuation of numbering, so we still go to 1 to 7. So number 7 is number 11. So we also have therapeutic marking, and again the same cutting, but this is meant for healing. This is done again with a name to heal the person of whatever kind of an illness, depending on their background, and this is also mainly done traditionally. You hardly find that we have this being done in modern setup, but we can never rule it out. You still find that there are those people who will tell you that there is the punching part of it, of your body, which will help release high blood pressure, solve this kind of an illness. All that kind of a debate keeps on going round. Then we have female genital mutilation and circumcision. And this is where you find that, and this is for the circumcision, this is male circumcision. Again, you find that if the instruments being used are shared among the people who are practicing this, there is somebody who is infected, then there's a likelihood of transmitting the infection for the people who are actually carrying out these practices. Now, we have this ovulectomy, and this is the removal of ovule. Now, what is this? This is a part of your skin on the throat, inside your mouth, which many people tend to remove because it is associated with respiratory infections. I think I have seen people undergo this, and this is not done in a hospital. It is done by traditional men and women, and this is where you find that somebody will come with a razor blade and will just insert it in your mouth and snipe that part and remove it. I don't know why it is still happening, because again, it is a misinformation that because you are having respiratory infection, this is the cause. It is important to seek medical care when you suffer from this kind of things, instead of trying to look for traditional ways to heal yourself, which could expose you to transmission of HIV and AIDS. Because again, you don't know how this is handled, the equipment that are being used, their safety, and that is something that we must really think and talk about. That why would you want to do that? Because you think that if you do that, you're going to heal yourself automatically, the respiratory infections. So it's something that we should keep on discouraging. And then we have sharing of skin piercing instruments. This is also possible. Tattooing, again, you're also using sharp instruments. We also have the intravenous drug users who are injecting themselves using needles and syringes, and then they share amongst themselves. So remember, we said that blood is one of the fluids in which HIV and AIDS is transmitted. So if this silage or the needle, there is a remnant of blood, and these people are sharing that, then the possibility, if there is an infected person, spreading that amongst themselves is very high. And of course, we have the occupational exposure. And this is the transmission that occurs in workplace. And in workplace, for example, this is where we are looking at people who are handling HIV and AIDS patients, and they also have broken skin, and they are coming into contact with the body fluids of the patient. And also the needles and the syringes again, if they are not properly disposed. For example, let's look at a hospital case scenario where we have a disposal or a disposal chain where this person uses the syringe and the needle, disposes that in the bin. There's another person who will come and dispose that to the main bin, and that cycle continues. So by the time we are ending up with the final disposal procedure, we may have somebody who is already exposed to the virus from these waste materials. So that is important to note. However, this is very rare these days because of the protocol and the procedures that have been put in place in hospitals and for anybody who is taking care of the person who is infected with HIV virus. And if I can also compare it with COVID spread, you found that in the initial days, when the virus was not very well known on how it is being spread, we had so many doctors contracting the virus and even dying from the virus. It is the same thing. Over time, people know and are able to understand the preventive measures that they should take to protect themselves from this exposure. Now, having said that, I want to share one of the pages here where you can see the classification of the various stages. We have clinical stage 1, and this is also not very clear from my end, so I might just pull it out. And we have the signs and the symptoms. And the stage 1, we said that there are no signs and symptoms. And what you may find is just the swelling of the lymph nodes. And these lymph nodes, these are the immune system organs. For example, tonsils. You will have other lymph nodes distributed throughout your body. Stage 2, we have weight loss. We have this is mucocutaneous manifestation, and this is a parasite disease which is affecting the mucus, the mucosa membrane, and also the skin. Cutaneous is the skin. Then you have the viral infections for over the last 5 years, recurrent respiratory tract, but I would also want to see what is happening to our YouTube. Probably that's where the questions are. So Boniface is asking, what is wrong with this channel? It keeps hanging. That was something different, I think so. So let me see the questions that are there. Slides are very clear. That is one of the feedback. Another person says notes are not clear. Why escape tattoos? So Kevin, do you mean that tattoo marks, we know what they are? These are mark on the body, which are actually supposed probably to communicate to a person. It is the same as the traditional markings that I talked about, but they are different because for this one, and it may take some time to heal. And this is where you are doing it deliberately, probably to marking yourself with a lion, a house, a name. So tattooing is where you actually getting the beautification marks in a different way. So it is the same kind of a thing that I explained there. Here at the, when I was talking about the scarification. A scar will also result, but in this case, this scar is definite, and probably I can just show it because Kevin, is so passionate about the tattoo. And actually, they are forbidden in the Bible. So just make sure that you are not tattooing. So I'll share this. So you find that these are what we are calling tattoo. Like this one is labeled King, Maria, Jack. Yeah. So it is the skin. It is the skin which have been pierced, and these designs have been designed on your skin. And you can see there's a different types of colors that you can use. You can see, I think the lion is the most popular. I think it is sharing. Just be patient a moment so that we can see what we're talking about. As that loads, I want to check on any other question. Now, these ones that are asking about the lecturer's name, you must have joined. I introduced myself completely. Gojiri Josephine. I even showed my photo from the web. So make sure you are joining the class early. Scarification and tattoo, which one is which? For scarification, the scar is not necessarily a design, and that's why I'm saying different communities do different things. But the principle is the same. The principle is the same. When there is a presence of the cells also, this is when Maureen, I cannot get a question. Repeat ovulectomy, please, so that I can help illiterate people. Yes, people are given even the Bible verses. Leviticus 19, read. Thank you. Now, let me go back to ovulectomy. I said that this is not necessary, number one, because the reason why people believe that they should do it is because they believe that it will cure the respiratory infections, which is not true. Which is not true. So it is not true, and this is why we must keep emphasizing that it is not necessary. It is not necessary, and it poses a risk of transmitting HIV virus. And I say this is the removal of the part of skin on your throat through the mouth. So the person will insert whichever instrument they are using through your mouth to reach your throat, and then they snip that part, which is thought to be vestigial, or rather having no function in the body. I can see another question. Please explain to me the meaning of ovulectomy. I have repeated that, Carl. Other occupations which can transmit the virus other than in the hospital? That is the question from Mohojo. Yeah, where you are using sharp instruments, then in those occupations, if somebody comes into contact with a sharp object which had come into contact with an infected person, then in that occupation, that person is also exposed. And then give us what is the difference between tattooing and scarification. I have said that tattooing, this is where you have tattoo marks. Scarification is tattooing is one form of scarification. Yeah, because again, the scars are permanent. The scars are left there on your skin. So a tattoo is also a form of a scar. And then when someone is being tattooed, does the instrument come into contact with the blood? I hope the person wanted to ask, are there other effects of cutting ovula apart from the spread of HIV? Not really, and it is also not necessary to do it. And ovula, we said that it is that elongated part on your throat. You have done this many times. If you just put your tongue out, Adamila, you can see it. So if you just say that, and most of the time, even when you go to hospital, the doctor tells you to say and then they are checking whether there is infection around that point. So ovula, it's not ovula, it's ovula. So somebody is asking what? Let me see. How long can HIV virus last in those sharp objects? It have been debatable, about 4 minutes. I don't know whether there is a consensus yet, but it have been said aloud 4 minutes. What are intravenous drug users? Intravenous drug users these are the people are using the veins, venous vein, the blood vein, to deliver the drug in their system. So intravenous drug users, they'll need a needle and a silage to inject the drug into the vein. So intravenous drug users, these are the people who are not taking drugs orally, because we have, if we look at what is a drug, we know that we have many kinds of drugs, but in this case, we are not talking about the drugs that are administered orally or people take them orally through the mouth. We are talking about people injecting into their blood veins with the drug. That is what we refer to as intravenous drug users. Before we wind up, hivyo umesema ovula kilimi hiyo ni sawasawa kabisa. I don't know in the other languages how it is named. Oh, it is a symbol of braveness. I didn't know. Now, cutting ovula is a symbol of braveness. Oh, or lion. Tattooing lion. I don't know. Just keep away from it. The Bible have told you to do so. Can a girl, I can't read this, Harrison. Can't be able to read your question. Can a girl so attack animals? I don't know what you mean. Is tattooing painful? I have not tried it. I'm not planning to. But from the fact that it will leave a scar on your body, any scar is going to be, any process that is going to leave a scar on your body is definitely going to be painful. Is intravenous drug users not the same point as sharing of piercing instruments? No, it is different. It is different because in this case, the piercing is on the skin. The intravenous drug is being injected on the blood vein. So that is a little bit different. That is different. Piercing the skin and getting to the veins, blood veins, it is different. And you find that the skin piercing could be accidental, could be deliberate, and the intravenous drug users, that can never be accidental. It is actually a deliberate choice for that person to do that. Can PrEP medication prevent HIV infection? Almost 100%, Daniel. So it is important. Gitao asks, how long does it take? How long does it take a person to be in a carrier stage? Now, once you are infected, it will depend on your immune system, but definitely the virus will gain access to your system, and this will be discussed under the lecture which is upcoming on the immune system, on how the virus will establish itself and how long it will take. And now you will be in a carrier state if you are not showing any symptom, or if you have not been able to overpower the virus, if you have not destroyed the virus. Yes, we are going for a cut, so I can release you. We can keep on answering the questions. Thank you for bringing that up. So keep on typing. This discussion continues. For us, Group C, we are going to just meet very briefly in our usual venue. And somebody is asking here, this is an important question because I talked about it. Is it true that HIV can be prevented within 24 hours after being infected? It is not after being infected, it is after the exposure. After you have been exposed to HIV virus kind of scenario, and I gave those kind of scenario, the post-exposure treatment PEP is given within 72 hours, but every hour counts. So if you have been exposed, the earliest you start your post-exposure treatment, the higher chances for you to not get infected. So that is true, Jacinta, but this is after exposure, not after you become a carrier, no. Because being infected and being exposed, those are different things. When you are infected, what we can do is lower your viral load. But when you have been exposed to the virus, we can prevent the infection from happening. And this is what we are calling the the virus destruction state. So the virus have been destroyed at this state. You do not get infected. Please, Jacinta. So infected and exposure, those are two different things. So once you are infected, we can only lower your viral load. But when you are exposed, we can prevent the infection from establishing itself in your system. So that must be very clear. And because you are going for a cut, okay, thank you that you got that message, Jacinta, very well. Because you are going for a cut, I want to stop there. Keep on asking the questions in all the forums. Keep on continuing with engaging in the A platform on the discussion forum, and definitely we will communicate when you have your cut one. And of course, we have our course outline, which is very, very important to have. Ensure that if you do a copy by now, you download a copy. So that is very important. How long can take one to notice signs of HIV? I think I said that is dependent on whether there is any intervention with the ARV or particularly your immune system. So that is highly dependent on an individual capture. It is not definite for or the person with HIV. So I wish you all the best in your, and I wish you a good day ahead. Bye-bye. See you. Continue with the questions.
You are currently the only person in this conference.